Hello again, everyone, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and today we are going to look at how philanthropy shapes healthcare in our community. Behind every new piece of equipment, every program that goes beyond basic care, and even a lot of the resources that support families, there's the Monument Health Foundation. So joining us are Hans Nelson, director of the foundation, and Dr. Patrick Tibbles, who's vice chair of emergency medicine and medical director of the hyperbaric program, and about two other titles that I didn't throw in on this one right away. Together, they're going to share how donor support and community partnerships do make a real difference for patients right here at home. So, gentlemen, thank you guys for coming back. You've both been on here before. Glad to have you back.
Thanks for having us.
You bet. Dr. Tibbles, just real quick, I was hoping you were going to show up like you did at the Golden Guitars, but you did not. So you had one of the best costumes there.
Yeah.
All right. And that is the Golden Guitars, of course, is one of the it's one of the biggest drivers
100%.
that raises money for. How involved is the foundation in the Golden Guitars?
That is our event.
It's the whole thing.
The whole shebang.
Okay.
I mean, obviously, we contract and work closely with Corey Van Sickle from Corey and the Fireflies, a local Rapid City Inn. He coaches us and works with us on the event, but now with it being our fourth year, I mean, it is our event. We pay for it all. We do all the marketing. We handle all that stuff internally, and then we create the guest list and get the folks there, create the hype around the event, bring the party, bring the fun, and really go after raising record-breaking numbers. I mean, this event replaced the duck race. That was our big Children's Miracle Network fundraiser that supported all of our PICU and NICU and all pediatric-focused programs. And we went from, I think duck race in its prime was making a little over 90,000, and this year we just did 500,000.
That's just for that event, that
one night. It's remarkable.
Well, it's because of how Dr. Tibbles looks.
Exactly.
I mean, he's the one that brought it all in. How did you decide on that outfit that night, Doctor?
I married my wardrobe person.
Yeah.
That's how I did it.
Oh,
She is very creative, Mark.
It was awesome.
It was a blast. All right. Well, to start, for listeners who may not know, what exactly is the foundation, and more specifically, what's at the heart of the mission for this?
Yeah, so the foundation, the Monument Health Foundation, we are basically the philanthropic fundraising department within the hospital, and we're there to support all the service lines, programs that aren't really revenue generators for the hospital, but are necessities for care and helping our community stay healthy and strong. And so we're there to collect those donations. The one thing I want to say is what we are not, which we get a lot of confusion with, is we are not the sponsorship department. So most community members think foundation, I'm going to go for them to ask for money to support our local fundraiser here in town. That is a completely different department, not associated with us. Obviously, we work very closely with our community relations department, but that is our community relations team that handles sponsorships where Monument Health gets out there in the community.
Okay. Well, from your perspective then, in the emergency room, Doctor, how has the foundation's work shown up in the care that you're able to deliver?
Well, thanks, Mark. First of all, I don't know if I mentioned this to you, but one of my most important roles right now is medical director of the foundation. And that gives me the opportunity, as an old rock drummer many years ago, to have a new life supporting our community. And I am able to do that through the wonderful foundation, which is really becoming more and more the backbone of improving our care in the area, improving the care to my patients, my family, and helping us keep our healthcare local.
So why is this so important for you? Why did you go from what you were doing to making this your most important, like what you said, your most important job, the one you feel most connected to?
Well, as a physician, my job is not only to take care of people and cure people, but also to develop relationships. And that's how you provide good care, is developing relationships. And I had the wonderful opportunity in a long-time patient relationship to provide a high level of care, and that led to a very generous donation. And I realized through Hans's leading and information, as well as Dr. Archer and Paulette, our CEO, that the foundation is vital to maintain the level of health care that we need for all of us in the community.
Well, and you can hear it. I mean, in the way you guys are describing this too, the importance of it, I think, for sure. Well, Hans, can you just real quick, like, walk us through a project or a campaign where, and we kind of touched on this though, where donor support made a big impact on families. Can you specifically?
Yeah, I mean, I would say, obviously, Children's Miracle Network is a great program that we're partnered with, and with that, it just gives us a ton of tools and support towards major campaigns and fundraising. I would say, yeah, we did. We talked about the Guitar Gala. I'm trying to think of something else so they don't solely focus on Children's Miracle Network.
Right. Yeah, that's a good question. Like, where are the...
Yeah, so the other big areas that we really support and do a lot of fundraising is cancer care, as well as hospice care. So we do a lot of our events, we do a lot of our campaigns, a lot of our cultivation within the community are focused around those three areas, because those three areas, I think, are kind of a universal but very popular areas of care that impact a lot of people. And so, for example, hospice, coming up here in September, November, we'll be doing our Tree of Lights mailer. And we send out a piece of mail to, thousands of people that have been touched or have donated back to hospice care. And we raise close to $80,000 sometimes just with that mailer. And what that goes to support is equipment at the hospice house, which we're very fortunate in our region to have such an amazing facility that takes care of family members in end-of-life care, but also the in-home patient. So we've purchased thermometers, new and upgraded thermometers for the care team that go into the homes to take care of hospice patients. We've helped with educational pieces. I mean, families going through grief, there's some bereavement support that we want to provide. So those fundraising efforts really help with that, but also in-home equipment. It's amazing when you have a loved one in hospice care in their own home, the upgrades that need to be placed into those residents to help them receive their care or help them with ease of access, whether it's support with putting in arm bars. The foundation wants to help cover those costs so we can continue to support those patients going through hospice. So that's hospice.
Right.
Cancer care, I mean, we purchase thousands of wigs for families that are for women and men that are going through cancer chemo and just really helping restore their image as an individual. We do that through our Tough Enough to Wear Pink campaign that comes up in January, but also a lot of donors that just want to show support for that. So those are our big ones, but I also I don't want to fall short of other programs. Diabetes education. We have an incredible diabetes program at Monument Health where we come in as we help purchase sometimes their insulin devices. We also help purchase for kiddos a Pink Panther diabetes book. So imagine a little 5-year-old kid who now is diabetic. There are books out there that are written for children, for parents to read to them to help them understand what is diabetes and how is this going to change my life. So we help purchase those books for those departments. So from big things, from a transporter isolette that was a $300,000 device that we purchased for our NICU, down to the Pink Panther books that I just referenced.
Well, don't forget, Hans, too, that because now that I'm in the foundation, you've helped me realize how important emergency services are.
Correct. That's a whole other department.
Right.
Exactly.
And because of the foundation, we were able to buy 2 very crucial ultrasound machines so we could take care of critically ill trauma patients, those who are in septic shock and go into the ICU, those kids who are sick as well, gynecology and OB emergencies. And so it has really been a wonderful thing for us to improve care for emergency services, which is really, the emergency department is the safety net of our community.
Yeah.
Right. Does it ever feel like it's just can you ever feel like you reach your peak with the donations that come in, or is it a constant, we just have to keep going day after day after day?
It's constant because things are changing every day.
Right.
Whether the type of care or I'll use Dr. Lemley, for example. He, prior to him being employed with Monument, we had an advanced care unit in the pediatrics department. Because he has a specialty of being a PICU physician, we now can call our hospital a PICU hospital.
Why is that why was that? Because that was sort of contentious, wasn't it? I mean, the naming. I know I've talked to Dr. Lemley on other podcasts, and there was a moment when it was first coming about that we couldn't say that. Why?
It's because of the type of care that we can provide now. I mean, prior to that, and this is also where it's great having Dr. Tibbles on our team, because he's an encyclopedia of the clinical world, which our foundation isn't.
Right.
So when I'm meeting with, and I'm sorry, I'm going to digress on it for a second, but when I'm meeting with a donor, having someone that is on the boots on the ground in the clinical setting, he can speak a completely different language to those individuals. But what's also great is his connection with other physicians and explaining to them in their physician language how we work and how we can support them. So do you know that answer? Like what would make the anecdotal between being an advanced care to a PICU? And from what I've understood, and he can clarify, it's really coming down to what is his specialty? What can he do that a regular pediatrician physician can provide?
Well, the Pediatric Intensive Care Unit, or the PICU, provides the highest level of care for the kids in our community. So we now have a full-time, fully trained, board-certified, multiple board-certified intensive care pediatric doctors. And we have the appropriate ventilators to allow kids to breathe, and we have other critical care supplies that just was not available in our community until Dr. Lemley was recruited and came here and really changed our program.
Okay. So doctors obviously are kind of we think you would say a critical part of this foundation. You need, how many doctors are a part of it?
I would say we have between 5 and 10 as physician advisors, in addition to myself as the medical director.
Okay.
But really, all physicians are part of it in that they provide top-notch care. And the way to make that happen through the foundation is to improve the services we have, to bring more services to the community. Like we're looking at maybe a blood cancer program or even more specialized pediatric programs, increasing the level of cardiovascular services. And all the physicians that are involved in those departments are vital to helping us get the resources from the foundation into the hands that are going to change people's lives.
Well, you said something interesting, Hans, about having a doctor like Dr. Tibbles be able to go back and explain to other physicians in their language exactly what the foundation does. Can you just expound on that a little bit more?
Yeah. So it is a world. I sat in on a physician or a new physician orientation.
Okay.
And I've normally gone by myself with another colleague that we're just foundation. And, there's these physicians, they're new, they're drinking from a fire hose and all the training and new things with what it's going to take to now work for Monument. And then Dr. Tibbles joined me in the last one. And there's just a world that they understand, the med school component, the healthcare, what they're going to provide. It's just not that they don't respect us, but there's just a different level of respect when you have a new physician starting and a veteran physician that's been there for 30 years talking about the excitement of having them join the team. But it's hard to explain. But there's also the board certification dialogue and terms and all of the different just connections and understanding. But also like he's walked in their shoes. He's gone through med school. He's been in hospital settings. He's saved patients. He's helped patients. There's a different level of admiration and respect that I think physicians have for one another. And because I can go to a group of physicians and talk to them all day about the impact. But if you have a physician that can go in there and say, hey, this is what the foundation can do to help your department, it has a deeper understanding and connection than I'll ever have. And that's what I think. So with his role, this is a very unique partnership across the country in healthcare foundations. There's not a lot of healthcare foundations that have a dotted line connection to a medical director for the foundation. I mean, this is a new concept.
Well, it just seems like the doctors that you're working with and the ones you're trying to help explain this to, it just seems like, look, they're here to give you, hopefully to give you the equipment that you're going to need.
Exactly.
Right? And so I guess in my mind, I'm wondering why do the doctors find that strange?
Well, because we have always been two separate worlds.
Of course, right.
The foundation knows that we need money to make programs work,
yes,
to buy equipment, to build processes and facilities that are going to allow us to practice, and we're the ones providing the actual care, bringing that care directly to the patient. And now all of a sudden we have this wonderful relationship where I can see directly how this money and the incredible things that Hans and his group does to get money in so that we can begin to improve all the care that we're given.
Okay.
And nobody knows medical care better than physicians and the physicians who live and work in our community.
Yeah.
Well,
okay, that makes sense.
To expand on that just a little bit more too, because I don't want to discount the other frontline workers, the nurses, the CNA, the certified nursing assistants, the EVS crews that are working day in and day out with patients. What we're starting to realize, and why I love this partnership now with Dr. Tibbles and him being on our team, is they're with those patients. They're there impacting their lives, saving their lives, saving a loved one's life. They're there on the front line. That then leads to relationship development, cultivation, gratefulness, which then leads to donations. So really, they are the front line for the foundation, not only for the hospital, but they are there building those relationships, impacting lives to where it's going to later inspire those individuals to give back, to support, so they can go, I want this hospital to continue to serve local and keep people local. I want the same patients, the other patients, just like myself, to have the same experience. I want to give back to support them. Or what we love is telling the stories of, back to the ventilator with Dr. Lemley. There was a patient that had to travel to Colorado because we didn't have this certain device. Dr. Lemley came in and said, can the foundation purchase this device? And this family no longer needs to travel to Colorado. And I mean, it was a $40,000 ultrasound. We had money within our Children's Miracle Network fund that paid for that. That family no longer has to move to Colorado because of that, because he had that connection with that patient, that family, realizing, seeing an opportunity, reaching out to us, and then we had donors donate to that to make that piece happen. And when we told that story, like, hey, help us raise $40,000, we're going to purchase a device, we're going to keep this family and future families here in Rapid City.
Right. So you guys also must focus on, I mean, it's not just the equipment, right? That's not, I mean, that's a big part of this, of course, because that's tangible things the money can buy, right? But what about things like mental health? Overall wellness, I suppose the foundation, this is something you guys look closely at as well.
Yeah, so we a lot of our funds too go to education programs. We have a sexual assault response team. SART is the acronym. They have a fund within our department that we help support their team to get educated in that world. That's a whole world that exists within the hospital system. Whether it's working with patients that have gone through that and they're in the hospital because of an incident that happened. And so there's special training. So we help pay for that training. Mental health, you talk about that. We help purchase, and this is very basic, but it's a huge component to the behavioral health clinic here in Rapids program. We help purchase the plants that they plant in their garden. So patients that are in that facility, providing that outlet for them to be out in nature, to learn cultivating a plant and from seed to fruiting vegetables that they then, harvest at the end of the year. And so we help with programs like that. One of my favorite funds that we have that overall just kind of reemphasizes Monument being a great place to work is we have a fund called Caring for Our Caregivers. And this fund was created to support caregivers in need. So let's say, for example, the applications that come through our committee that reviews this are pretty heartbreaking, just because obviously you then realize that these are caregivers, the nurses, the whole team, they all have lives outside of the hospital. So like a mother applied, her son passed away unexpectedly. So she applied for this grant. We were able to give her $1,500 to go towards any of the funeral and costs that came with that. During the Ukraine-Russia conflict a few years ago, when that kicked off, there was a caregiver from Ukraine. We purchased her airline ticket to fly back to Ukraine to bring her family to the United States. Families whose houses have burned down, we've helped pay for hotel rooms and food for them. So that's a fund that our own caregivers donate to. People can elect to do payroll deduct, one-time donations. We've received memorial gifts. Goes into that fund, and all of our caregivers have access to apply for that to support them through a very traumatic experience.
Those are some things nobody would think about when this foundation happens. Well, and then on your side of it, Dr. Tibbles, I mean, how do the nurses and other staff that you work with, how do they feel about that? Do you talk with them about that? Do they feel like this is why I like to work here? This is one of the reasons why Monument is beneficial, because of this foundation.
Yeah, I think more and more I've been able to bring more clinical relevance to the frontline providers, such as our nurses and techs and registration people and EVS people, and show them that how relevant this is to making their lives better when their family, friends, or themselves get sick, and for others in the community.
So what are your goals moving forward then? What are you looking for in the next 5 to 10 years? What are you hoping to accomplish with this?
Well, one of the things, if I may say, that because of the relationships that we've built in the foundation and the support, Monument has been able to put together a wellness and prevention clinic called Med 360 that offers a membership-driven, incredible primary care experience with care navigation for other specialties, and in partnership with MDVIP out of Boca Raton, Florida, a national network in almost every state that includes 1,100 clinics and 1,400 primary care providers, in addition to 40 different five-star healthcare organizations. We already have our wonderful care network with Mayo Clinic, and this just expands it for the first time in South Dakota to a whole another level.
It just seems like I remember Monument back before Monument, when it was just, Rapid City Regional Hospital, when it was a small hospital here in Rapid City, not small, but the hospital here in Rapid City. The changes that have happened seem to have been so fast over these last few years. Is there a reason for that? Is stuff like the foundation a part of that?
Yeah, we're a big part of, let's just look at the capital physical expansions, the Cancer Care Institute and that whole remodel. Even the hospice house that was built in 2012, and now upcoming the children's expansion. So the foundation has had a piece in all those to engage community members that want to give back. People like those tangibles and like to be a part of feeling like they were a part of seeing something be built and developed. I think it's also just the rapid speed that Rapid is growing, and the Black Hills in general. Yeah. It's just Monument has really started to anchor itself to where we are here to provide the best healthcare, quality healthcare, and by doing that, we have to expand. All the urgent cares that are going up. Box Elder just opened. Rapid Valley will be opening here. I think it has this week or within the next week. Now the emergency department, a standalone clinic over there off of Mall Drive. So we're growing because the community continues to grow and there continues to be a need. And I think we're really trying, there's a priority, a goal that Monument has called to be here for generations to come. And we're identifying how we as a health system can continue to be there in the areas of need. But also the foundation's role in that is how do we continue to fundraise and support those areas of the hospital that aren't high revenue generators? Because here's the thing people don't really realize is the payer mix that we have here, the health insurance reimbursements, 70% of our patient load are in some kind of payer mix that does not reimburse the hospital very well. And so the foundation's here to help support those departments that maybe aren't high revenue generating departments, to help them continue to be on the cutting edge by purchasing equipment or supporting a specialty that we want to try to get in. He referenced the blood cancer. That's a constant conversation. What do we need to make that a priority so we can keep patients here local? So in terms of what are big goals, though, really quick for the foundation, I think it's to continue helping the community grow and the Monument Health grow in the community. But I think also awareness. We have 6,000 employees in Monument Health. I still meet people in the hospital whether they're in Custer or they're at their clinic in Buffalo, South Dakota, that aren't aware that we exist. And by having Dr. Tibbles and the medical team now aware, because there's a lot of physicians that don't know that we're there, that we are here to support them.
Right.
And if there's an area of need that maybe they can't get budgeted in their operating budget, but the foundation can help pay for that to help us continue to grow, that's my ultimate goal. Like, I want to continue us to grow as a health system and be there as the foundation to support financially and engage community members to get behind that. Because I can't tell you enough, whenever you tell people that by purchasing this, it will help keep thousands of people local, people donate.
Right. Well, that's a great way to approach it.
Yeah.
Well, and the thing that Hans knows as well, and one of the reasons I am still here doing this with great passion is because our leadership at Monument now is the best ever. I've been through 5 administrations, and now we have Paulette Davidson, amazing CEO, our Chief Medical Officer, Brad Archer, who supports the foundation at the highest level and was crucial to building this wellness and prevention primary care clinic, and of course our the head of the foundation, Robin Zabrowski, our brand vice president. All those people have incredible passion and vision. They understand the importance of the foundation at the highest level, and this really helps engage so many people and making us more and more successful.
Right. The whole time I'm listening to you guys describe this and talk about this, there is one question I think that the people listening to the podcast, at least some that don't understand how the medical profession works, are thinking right now. And they're wondering, look, it costs me so much to go to the doctor, right? It costs me, these hospitals are making trillions of dollars every year, right? Why do you need a foundation? Why does something like this have to exist? How do you respond to people that bring stuff like that up?
Well, I go back to what I said earlier regarding health reimbursements. So I'm going to use the other hospital systems in the state. Sanford isn't growing and becoming what they are becoming in the United States off of insurance,
right,
and off of medical bills. It's because of a benefactor. Mm-hmm. Denny Sanford donated $400 million at the very beginning to take Sioux Valley Hospital to become Sanford Health. Avera, they continue to fundraise. The cost of medical care, the cost of where insurance reimbursements are, it just is difficult, especially for hospitals like us, because we're the only health system. We're the only public health care system here. Not the only health system.
Right,
I know we have
yeah.
for-profits out there, but we're the only public where we can't turn people away. And I like to use the example back to Children's because, again, Children's is not a high revenue generating department. My wife and I just had our first child. Mm-hmm. I think my medical bill alone was $40,000 for our baby. And she was in the hospital for maybe 4 days. We have children in the NICU for hundreds of days. And those babies don't have health insurance. The hospital has to write that off. The hospital has to pay for that. Yes, there's some insurance that does kick in or there is some government support, but there's a lot that goes into that care. And so with us and fundraising, we can continue to take care of these children, but also continue to get on the cutting edge where we're purchasing devices that, again, keep people local.
Right.
I think that explained it.
That was a great
well.
answer.
Okay.
It really was. I think and you said something in there that I don't think a lot of people get when it comes to that. Is like you said, you can't turn people away.
Yeah.
You're going to take care of people.
Yep.
Right.
Whether it's in
that
the
cost
ER,
has to go somewhere.
Yeah, right.
Yeah.
Right?
I mean, reimbursement for our public health hospital and community system brings in $1.3 for every dollar spent, whereas the foundation brings in over $4 for every dollar spent.
That's incredible.
This allows us to grow and provide the services that people want and need desperately and to keep our healthcare local.
Yeah.
So we need all of us to work together to grow our foundation so we can get these vital services and bring the best possible healthcare here, not in another state, not on the east side of the state, but here in the Black Hills.
And that's what we've preached on this podcast quite a bit when it comes to the ability to stay here, because when it comes to people, whatever issue they're having with their health, they will heal better if they can be at home, around family, around friends, and they don't have to hit the road. I mean, I think that's
absolutely
kind of underrated when it comes to medical care.
Right.
Yep. So, now, we do have to send people away, but where we've really started to position ourselves is helping families, helping those individuals with hotels, lodging. There's certain things we can't pay for. Like I can't pay for a patient's hospital bill.
Right.
But I can help them with the resources they need to come here or go there. Like whether it's Colorado, Omaha, Sioux Falls sometimes. So that's where also we want to be there to support them. But I mean, there's realities. We'll never become a children's heart hospital. I mean, it just probably, I mean, I shouldn't say never. Who knows? Maybe in 30, 40 years, we have a benefactor donate millions of dollars to make that happen. But the reality of it won't be there. But there are some very critical, essential needs that we can be here to fulfill to support the continual growth and development of the community. And, you know, he keeps bringing up the ER, and I forget about that. We have the busiest ER in the state.
Right.
Right? And so the patients that come through there and the support we give to them as well is huge. And I don't think people realize that as well. I think when you really sit and think about it, go, oh, I guess it's a huge tourism spot. But like it's pretty insane. And the patients they see and the kinds of patients and the care is pretty astronomical. But yeah, we would just want to create a culture of giving and philanthropy.
Perfect. And if you go on the foundation website to donate, you'll see how many different service lines there are that you can pick and select: emergency services, critical care, pediatrics, gynecology, mental health, addiction. And that just says how much the foundation is doing for our community.
So is that the best way for people to that want to get involved? Is to go there? What would be the what's
that would
the
be
site?
probably the best starting place is monument.health/foundation. And you can learn more about our foundation and what we do through our events, through the different campaigns that we have going on right now or that we're finalizing. But I think the other one is just we love attend an event. Like if it's a golf tournament or it's a guitar gala or if it's the hospice derby night in the Northern Hills, come to an event because we utilize those opportunities to educate people on what we're doing, how we're impacting the community. But I think also just asking caregivers, like whenever you're in the hospital and you're sitting there in your waiting room, have an opportunity to just sit down and talk to a caregiver and understand what's going on in their world, but also what's going on in Monument Health. And I think people would be surprised by how educated people are with what's going on.
That's awesome. Is there anything we missed?
No, I think that's pretty awesome.
We got it?
I think we did.
Speaking of the ER, how was it for the rally this year?
Crazy as ever. Crazy as ever. You know, it was the 85th rally. And we're seeing an older biker crowd, so we're seeing more and more illnesses, not just injuries, to help take care of them. But they're always very grateful, and they buy us pizzas and send cards. And it's not the place you want to wind up on your biker vacation, but thank God it's there.
Yeah, that's great. Dr. Patrick Tibbles and Hans Nelson, the director of the foundation, the Monument Health Foundation, of course. Thank you guys for coming in again and talking about this.
Of course, thank you.
I love the fact that, you guys have very succinctly laid this out and explained why it's important. And I know we love being a part of it with the Children's Miracle Network every single year. It's always something we look forward to, and I cannot wait for what Dr. Tibbles is going to wear next year at the end.
Yeah,
okay?
Exactly right.
Just if we can get like a sneak peek of that, maybe we can match up a little too, all right? We'll get a bunch of people to tie in.
Yeah.
Thank you guys. Appreciate it.
Appreciate it. Thank you.
Thanks, Mark.